Hi everyone, and welcome to the webinar. How do nurses and midwives keep information safe for ourselves and the people we care for? The Australian Nursing and Midwifery Federation and the Australian Digital Health Agency have joined together again in this second webinar of this digital health series, discussing the important role nurses and midwives play in Australia's cybersecurity network. I'm Julie Reeves, a registered nurse and the ANMF Strategic Lead Aged Care. Thanks for joining us today. Before we begin, I'd like to respectfully acknowledge the traditional custodians of the lands where each of us are speaking and listening from today. Currently, I'm speaking to you from the lands of Wurundjeri people of the Greater Kulin Nation and recognise their continuing connection to country on lands and water that was never ceded. We pay our respects to elders past and present and extend that respect to any Aboriginal and Torres Strait Islander peoples joining us today. Today's presentation will be recorded and our entire webinar series is available at the ANMF Federal Office website at anmf.org.au, where you can also access digital health training, podcasts and resources to enhance your digital capability. So I encourage you to check it out. So let's get started on today's webinar. Today we are joined by two cybersecurity experts from the Australian Digital Health Agency with extensive experience in the industry. Tracy Weeks. Welcome, Tracy. Tracy is the Manager of Cyber Awareness and Education of the Cybersecurity branch. Tracy also has over a decade of experience in cybersecurity and healthcare and leads her team within the cybersecurity branch to drive cultural change across Australia. Tracy's focus is on the workforce being the key to ensuring the protection of information and service delivery. And we are delighted to have your input today, Tracy. Kim Clark is the lead officer. Hi Kim. The lead officer at the cybersecurity branch at the agency. Kim has over 6 years' experience in cybersecurity, working across both private and public sectors. And Kim thrives at delivering people-focused cyber solutions, including awareness, education, policy, and compliance. And it's also my pleasure to welcome Nicola Graham, the Education Manager of the Australian Digital Health Agency. Hi, Nikki. So I'm excited today to bring you to these voices. I don't think it's a dry subject. I think it's a very important subject. And as we all know, it's been very highly publicised in the media recently with a number of attacks. And it's an important role for nurses and midwives to understand and be aware of cybersecurity. At the end of today's session, we will have a Q&A with our presenters, and we invite you to ask any questions you may have and put them in the Q&A icon on your screen. At the end of the session, we'll also send you a 2-minute evaluation via email just to improve any webinars and to identify your thoughts on how the webinar went. So let's get started and listen to all this amazing information.
Hello, my name is Tracy. I am the Manager for Cyber Awareness and Education with the Australian Digital Health Agency. Thank you so much for joining us today. We are very pleased to be invited along to talk to you about cyber, which we know is, as Julie said, definitely a hot topic at the moment. There are lots of different topics we can talk about when it comes to cybersecurity. So today, we're just going to have a look at why cyber is important. We're going to have a look at how cyber attacks happen, and then we're going to have a look at the main cyber threats, and we'll end the session with some practical steps to help protect yourself and, most importantly, the information that is in your care. So we do hope to make this session as interactive as possible. So you can use the chat feature if you've got any questions or comments. We also want to prepare you for a little activity towards the end. So what we'll need you to do, feel free to try this now so you're ready when we get to that point, is to pop to that website you can see on the screen. It's called haveibeenpwned.com. This is not a trick, I promise you. And you can either do it via your mobile phone, or if you're at your computer, you can open a browser and pop the address in and be prepared. We'll remind you when the time comes and we'll get into the exercise then. Okay, let's start today's session. So digital transformation, it does continue to improve many aspects of our daily lives, including healthcare outcomes. However, as digital transformation and reliance continues for both organisations and individuals globally, the market of opportunity for cyber criminals also increases. So why do we need to talk about cybersecurity? Well, cyber criminals will always aim to find weaknesses in our organization that they can exploit through cyber attacks. So this is things like phishing and ransomware attacks. Their motives are typically driven by financial gain. So it's things like the demand for ransom to release locked data, which we now know is ransomware. And we need to understand that healthcare sector is a prime target. An attack can lead to things like the loss or theft of information, intellectual property and research data. It can cause significant disruptions to service delivery. It can cause reputational damage, and most importantly, a loss of consumer confidence. So a quick question to start thinking about. What do you think has a higher value on the dark web? Do you think it's the sale of a credit card or the sale of a healthcare record? Well, according to a recent TrustWave report, a healthcare data record can be valued up to about $250 on the black market, compared to about $5.40 for a credit card. We know healthcare records provide a plethora of information that can be reused for activities like identity theft and extortion. While a credit card is easily cancelled, can be replaced, and the funds can often be recovered, if your identity is stolen, it can have ongoing ramifications for your life. So I have been working in cybersecurity in the healthcare industry for well over a decade now, and we have been talking for a really long time about the attractiveness of healthcare data to cyber criminals. And we really have recently seen this come to light and witnessed the fallout from these kinds of breaches. So we're going to have a very quick look at some recent data breaches, specifically of healthcare information. So the very first one is back in February of last year, we had a private pathology clinic was breached. They had over 220,000 personal records breached in that attack. That included the tax file numbers of staff. It had people's Medicare numbers, driver's license, passports, their credit card details, and also their medical and health records associated with those pathology results. Then in October of last year, we saw the Medibank private cyber attack and data breach. This attack actually resulted in the largest breach of personally identifiable and sensitive health information in Australia to date, with over 9.7 million customers' records impacted. That included 200 gig of diagnosis, that had healthcare claims, and personal information, which was accessed and sold on a Russian language cybercrime forum. Medibank has announced as part of its financial report that the breach was a result of one of its users' credentials being compromised. What this means is that cybersecurity is everybody's responsibility. It takes absolutely everyone in our teams to be vigilant. So that's yourself, your staff, your colleagues, your IT team, and your vendors to ensure the availability and delivery of our services, and also the protection and integrity of the information and data entrusted to us. So ensuring that you and your team understand their responsibilities and take accountability for them, because one of the biggest risks to healthcare organizations' cybersecurity is very sadly the human factor. So developing strong cybersecurity behaviours helps prevent cyber attacks. Because when a cyber attack or a data breach occurs, it is actually rarely the fault of the technology. The Office of the Australian Information Commissioner reported that 96% of data breaches are the result of human actions. And of this 96%, 33% is due to human error. So that's things like people sending information to the wrong person or accidentally posting information online, while 63% is due to malicious attacks. So that's things like our email or phishing attacks. While this statistic can sound alarming, it's really important to know that there are some simple steps that you can take to start on this journey to protecting yourself and your organisation from cyber threats. So I'm now going to hand over to Kim, who's going to discuss how cyber attacks eventuate.
Thank you, Tracy. So how do cyber attacks happen? Because 91% of all cyber attacks begin with an email to an unsuspecting victim, we're first going to discuss email phishing. So what is phishing? I would be very surprised if any of us here today have not received a phishing phone call, email, or SMS message. But as a refresh to what phishing is, it's when cyber criminals pretend to be a known company, such as a government organisation or your bank, in an attempt to trick you into completing their requests, such as clicking on a link that will take you to a fake website and steal your username, password, or any information that you enter onto this website, or opening an attachment, such as a Word document, PDF, or other file that will in fact be malware, and as a result, will infect your device. Phishing attacks are often sent to thousands of people at a time. Criminals also like to capitalize on what's happening in the media or current events. So I do have on my screen a recent phishing sample that is being circulated, and ScamWatch has actually reported that MyGov-related scams were up 160% in January alone. But with awareness training, such as you're doing today, you can start to discern that this is a scam. So let's go through some of the warning signs. The first is that the email address is incorrect or is spoofed. So in this example, you can see that the name appears to be MyGov, but the actual email address is not correct. They will always use a generic greeting, such as Dear Customer. It's often unsolicited or unexpected, but this is how most people can get caught out because, hey, they were potentially expecting a refund or expecting a delivery that day. Good to be true. Does MyGov send out refunds? They generally do not, so be sure to critically analyze any content, particularly when they're saying you have a refund or you have an overdue bill. May contain spelling, grammar, or formatting errors. I say may because experts are now leaning towards that this is no longer an indicator because they are starting to use spell check and technologies such as ChatGPT to create seamless and flawless scams. And if you look at this specific example here, you'll actually see that there aren't any spelling errors at all. And there, of course, is always a malicious link. So you should never access your accounts through a link that is emailed to you. Instead, go to the official websites to access your account. But in this particular sample, if you did open the website link, you would have been taken to this website, which is a phishing website. And now this is why your attendance here today and ongoing cyber awareness training is so important. Because after today, you'll hopefully know that this was a scam and not to access the link. But if you did access the link, you will know to either look up or look down if you're using Safari on your iPhone at the web address bar. And it will tell you that this URL is dangerous, as you can see in the top corner. But keep in mind, these features are only available if your software is up to date, including your web browsers. Our modern web browsers today will tell you, hey, there is actually something fishy about this website. And if you do look in detail, you can also see it's not the correct website. So always validate that as well. Have some recent SMS phishing samples, which is also referred to as smishing. So the very common themes that continue to circulate are the hi mom or hi dad, my phone is dead, I have no money, please help. And unfortunately, Australians have already lost up to $7.2 million to this particular scam. The unpaid toll scam. So these samples were actually sent to me by a friend. So if you clicked on this link, you would have been taken to this website. And she unfortunately provided not one, but 2 credit cards before realizing it was a scam, then had to contact her bank right away. And I recently listened to a finance podcast where the host actually received this exact same scam and did the exact same thing, followed the link and provided not one, but 2 credit cards before realizing it was a scam and then reporting it to his bank. Next, we want to discuss business email compromise, or BEC for short, which cost Australians a reported $98 million in losses last financial year, and that is an increase of around $30 million from last year's reports. So it really is impacting and affecting Australian businesses. So what is business email compromise? Well, compared to phishing, it's highly targeted. Phishing, they're casting that wide net, hoping to get anyone or everyone, whereas BEC can be referred to as spear phishing. So the common types of BEC scams include CEO fraud. So the criminals pretend to be the CEO in order to trick staff into actioning their requests. Payment redirection fraud or invoice fraud. So that is where an organization's account is hacked and then used to request payments through fake invoices. Unfortunately, I am hearing this is increasingly common with building companies. A participant in one of our previous presentations said her family and others had sent money to a scammer as a result of their builder being hacked. And these were large sums of money, around $20,000 per transaction. So the personal stakes can be pretty high. And lastly, data theft. So the criminals may just target employees to obtain some personal or sensitive information about others within the organization, particularly the CEOs or those executives. If you look at the sample I have on the left, which is a copy of an actual CEO fraud attempt, you can see there aren't any hyperlinks or attachments like you would usually see in a phishing email. But this is a social engineering tactic. They're trying to first build that relationship and then make it seem believable. Then in the follow-up emails will be, hey, I'm so busy. Can you please transfer money to this account or make this fraudulent purchase? So how BEC attacks work? Criminals will compromise the email and IT systems of a legitimate business. They'll start to observe transactions and identify opportunities to divert money into their own account. So for example, if we think of, unfortunately, if a local building company is hacked, they've got access to their emails, they can see the outstanding invoices, and then they will instead edit the details and divert money into their own accounts. They'll impersonate the trusted senders, whether that's using the hacked email account or simply spoofing it, as we saw in the original example, where the name appears to be from the person you may be expecting, MyGov or any other business, but if the actual email address is totally fake, they'll send out that communication. The victim will complete the request, which is usually to pay a fraudulent invoice. And unfortunately, parties only realize they've been caught out once it's too late, when the legitimate company is then chasing payment, but customers are saying we have already paid. So how do these targeted attacks happen? Well, the first way is what we just discussed: business email compromise. An organization or an individual's account is hacked. It can also be eventuate through phishing attacks. Even though they are sent to thousands of people, if someone takes that bait, they will then use those details to launch further attacks and targeted campaigns to just keep getting more and more information. Data breaches. So website data breaches such as Canva or LinkedIn, or the large-scale Medibank, Optus, and recent Latitude data breaches. When these incidents occur, varying levels of personal information, including usernames, sometimes passwords, emails, are all leaked and sold by cybercriminals on the black market. So with this information, they can create believable targeted scams to continue to target different individuals. And in our activity a little later, you'll see the positive way of how these stolen databases are being used, and that is to inform people that their information may have been caught up in a data breach. Finally, targeted attacks can be developed just by simply gathering information from publicly available sources such as website and social media. And that leads us into social media. I'd be surprised if any of us on the call are not on social media, because almost 83% of Australians are on there, with the platform of choice among the majority still being Facebook. So I do have a video I'd like to show you that outlines just how private is your personal information when on social media.
Oh, hi, can I help?
Can I have a hot chocolate?
What's the name?
Joelle.
What was the name?
Alex.
Alex. There you go, Johnny.
Cheers.
If you like our Facebook page, we give you a free hot drink and a free pastry.
We have a new like for Damien. We have a new like for Damien.
Hey, Carly, are you standing by?
Standing by. Hi there, can I help?
Yeah, just liked your Facebook page.
Okay, I'll search Facebook now.
I'm searching Google.
Have a phone number.
I've got his email address.
Okay, Carly, are you ready for information on Damien?
Yep, I am.
Mother's maiden name is he banks with
Carly, this is the girl coming in now with the blue scarf.
What's her name? Nicholas.
Nicholas. His date of birth, 7th of May. She lives at 38A.
Just be a couple of seconds.
2 children, 8, 4 and 6. Previous address. She's got postcode.
Yep, got it. Damien, age 26 and a fitness instructor.
How do you know that?
Where did you go to UCL? Martin went to South Thames College. Assistant psychologist at Great Ormond Street. How did you know?
That is... I don't understand.
Huh? Pardon?
You know I'm a Christian as well.
Oh, yeah, we know everything about you, Martin. Thank you. Nice to meet you, Anna from Russia.
Please keep in mind that once you post something online, you have lost control of who accesses it and what they do with it. But later in this session, Tracy will give us some simple steps that we can do today to secure our social media accounts. Dark side of generative AI. So what is generative AI? It's something that's dominating a lot of the headlines as of late, and the most popular is you've probably heard of or played with yourself, which is ChatGPT. I'm also seeing the Snapchat AI bot getting called out for its very loose filters and providing detailed information on how to conduct nefarious activities. So while these technologies can be entertaining, they're also being used by cybercriminals to facilitate attacks. And they're using these technologies to conduct things such as facilitating romance fraud, so through different chatbots, creating fake product reviews, sharing misinformation or biased information, causing privacy issues. So if individuals are entering personal or private information into these bots, these are then being stored elsewhere without permission. And finally, they are helping cyber criminals, as I mentioned earlier, to create believable phishing scams, including phone calls, emails, and text messages. So just be sure to keep that in mind next time you think you've received something that's suspicious. What a scam. Before clicking on any links or attachments or sharing any personal details, stop and think, are my emotions heightened? If you are curious or stressed, consider this a red flag. Did this message come from a legitimate sender? Remember, it may appear from your bank, a government organization, but often the actual email address will not be correct. Did my colleague or friend actually send this to me? Remember, they may be hacked or someone is impersonating their accounts. How can you confirm? The old-fashioned way, by phoning them directly with details that you have sourced independently. Is this the correct website? As I mentioned before, always check the web address bar to make sure you're on the correct website and a secure website before providing any personal information. Does this offer sound too good to be true? If so, it probably is. Are there any links and attachments? Do not open a link or attachment in an email or other message unless you're certain it's safe. If you're questioning the validity, be sure to contact the sender. And finally, can this person prove their identity? If you've received a call, can they prove who they say they are? And if not, do not do what they are asking and just cut off communication and contact the company directly yourself. We're going to discuss ransomware, which, according to the Australian Cybersecurity Centre, remains the most destructive cybercrime threat. And this is because ransomware can impact everyone, from everyday Australians through to entire countries. In May last year, the Costa Rican government actually declared a state of emergency following a ransomware attack on nearly 30 of its government institutions, including its health, finance, energy, and social services departments. Thankfully, Australia has not experienced an incident of this scale at one time, but the potential remains for cyber criminals to cause widespread disruption. And perhaps some of you on the call today may have yourself experienced working at a hospital or a facility that has suffered a ransomware attack and understand firsthand the pressures it can place and the disruptions it can put on patient care. But what is ransomware? As a refresher, it is a type of malware attack where cyber criminals will steal and lock access to the files on your device or on the network. The criminals will then issue a ransom demand in order for you to get the key to unlock your systems and avoid the public release of data. The ACSC does not advise paying the ransom because there's no guarantee that you'll regain access to your information or prevent its release. It also makes you susceptible to further extortion, and paying ransom demands encourages and stimulates the economy of organised cybercrime. So how do ransomware and other malware attacks happen? They are the result of opening a link or attachment in phishing emails, opening any links or attachments in text messages or social media posts, downloading malicious software off the internet, and visiting malicious websites. Why is healthcare such a prime target for ransomware attacks? Healthcare is often seen as a lucrative target because of the criticality of the services delivered and the pressure on health sector organisations to maintain business continuity, the prevalence of outdated information technology systems, which are easily breached and because of the different security vulnerabilities on these systems. Thirdly, the valuable intellectual property holdings such as research, and we did see this at the peak of the pandemic, where COVID-19 vaccination research and supply chains were being targeted by different nation states and threat actors. Fourth, the public trust in health sector organisations, particularly those linked to government services. And finally, the personal and sensitive data holdings, which are valuable targets as they can be sold and leveraged for blackmail, which we unfortunately saw with the Medibank private incident, where folders of information, some titled HIV, STD, and mental, were publicly released for sale. While data privacy has always been the common concern of a cyber attack, a US study has found that cyber attacks can have impacts on patient safety too. And this was backed up by an incident in Germany. So what happened? An individual was being transported to a hospital by ambulance. Mid-transit, they were actually rerouted to another hospital 30 kilometers away as a result of computer outages from a ransomware attack. The patient passed away during that unplanned transit to the next hospital. However, cybercriminals reportedly stopped the ransomware attack after learning they'd disrupted the hospital and possibly caused patient death. Devices infected with ransomware, you should disable all connections to the network and the internet, so make sure you turn off the Wi-Fi. Sometimes turning on airplane mode will disconnect those connections instantly. Take a screenshot of the photo of the ransom message and contact your IT for support if you're at a public or private practice, or if you're at home, call the Australian Cybersecurity Hotline to report the attack and seek advice on how to recover. The ACSC is available to help all Australians impacted by cyber incidents, and you can contact them through their hotline 1300 Cyber 1 or their website. We will now talk through a case study, which is a cyber attack known as SEO, which stands for Search Engine Optimization Poisoning. Now, this attack is actively targeting the Australian healthcare sector, and actually the legal sector is falling victim to this too. So Trend Micro performed this analysis and released their report a little earlier this year. And we as the agency cybersecurity team also shared an advisory to our partners on this threat. So if you're not on our external contact list but would like to be, please let us know. But what is happening? In a nutshell, criminals are leveraging search engine keywords such as hospital, health, medical, and enterprise agreement paired with Australian city names. I have highlighted the poisoned links, but I have retyped the web addresses so you can see where they would actually take you. But how many people do you think analyze the source or website before opening it? We don't always, but we need to start scrutinizing and analyzing links and attachments before proceeding. And this one in particular is targeting our nursing and midwifery staff through an enterprise agreement. Now, if you opened that first site on the web on that list, you'd be taken to this fake blog forum. And if you read these posts, there's actually nothing concerning in the content. And if you then opened this web link that was so kindly provided by the admin, you'd be taken to this website here, which is probably a legitimate copy of the Nursing and Midwifery Enterprise Agreement. But hiding in this file is malware, a computer virus, which will install itself onto the device, and in the days to come, data will be stolen and likely ransomware will be deployed. So again, this is where cyber awareness training becomes so essential, and your attendance today here is critical, because we'll train ourselves to look up at the web address bar and the URL, what is it telling us before downloading or interacting with content. It also reiterates why it's so important to keep our devices and software up to date, because only the new browsers will tell us and have these new features. In summary, this is not a new type of malware, but researchers are seeing the healthcare and legal sectors being impacted by SEO poisoning. So the key takeaways are to first be aware, inform your networks that these attacks are happening, take caution and be discerning of the content on the internet and web searches. Don't trust it just because it's appearing in Google. There's even now an increase in them paying to have web advertisements. So to be the very first response on Google, always beware of where those searches are taking you before entering or clicking on any links. Follow-up question we sometimes get is checking the link, how do I know whether it's safe? So if we come back to this specific example, there are 3 ways to find the safest website. The first is only use legitimate and trusted organizations. So refer to the official government websites, anything that has health.gov.au or .com.au, because there are restrictions on who can create these domains. Secondly, while it is an active Google result, they have done a little due diligence by stating, which you may not be able to see, but this site may harm your computer. So always read and acknowledge those notifications. Google does have a safe browsing site status search, which allows you to check whether a website may or may not be malicious. But please use this with caution. Only use this site if you think you can safely copy and paste the link into this search. You wouldn't want to accidentally open a malicious link while trying to test whether it is safe or not. What can you do today to prevent ransomware or other malware attacks? The first is keeping your software, applications, and operating systems up to date. Never clicking on links in an email unless you're certain they're safe. Never opening attachments unless you are certain they are safe. And backing up your devices regularly to ensure if an attack occurs, you won't lose all of your important data. But I will now hand back over to Tracy, who will talk us through how we can protect ourselves from cyber threats.
Thank you so much, Kim. So this little stat we can see on the screen is actually a flip on the stat that we provided at the beginning of the session. So instead of saying that as humans we cause all the breaches, maybe we can start looking at like we can actually prevent 96% of the breaches. Something to think about. So how can we do that? Well, we're just going to look at some tips on how to apply all the different information that Kim's talked about today to your online accounts. So it's your work accounts and personal accounts, so things at home, things like email, banking, social media. So the first thing though we want to do, and we did mention this at the very start, is I've got a little activity for you. So hopefully you've popped this into your mobile device or on your computer, and it's a website called Have I Been Pwned? You may have heard of it before. It's actually a tool that was developed by the Australian security researcher Troy Hunt, and it's very safe to use. This is something that would be great for you to share with your friends and family and to do this activity on a regular basis. Okay, so what you do here is on this site, you can actually see if an email address or phone number of yours has actually been caught up in a data breach. And if you scroll down the page, once you put an email address in, you can actually see the source of where the compromise has occurred. If you're an Apple user like me, you may actually receive alerts that a password you're using is weak and is part of a known breach account list. The Apple are actually leveraging similar data and technology to what we see on the screen, which is excellent to see. So Kim has typed in my personal email address there, and we've used that one because I know I have a couple of breaches on that one. It's a very old email address, and you can actually see the different places where it was caught up. So as you go down, it says, oh no, been pwned. And as Kim scrolls down, you can actually see it was caught up in things like Canva data breach, which is a little graphic tool I used to use, Mathway, where I was helping my niece with some maths tutorials, and Words with Friends, which is one of those fun games to play. So I don't know if anyone is playing along online, but has anyone else, you may see, you've got more than 3. I have seen some people have up to 21 account breaches to their email accounts, especially if they've had them for a while. Kim said she's got 3 as well. So yeah, feel free to pop them in chat. If you've got some that you feel like you'd like to disclose. But if you has 48, well done to 10 to Jasmine. Oh my goodness me. 11 for Ebony. What do I do with this information now? That is the best question you could have asked. What do we do with this information now? The first thing we do, don't freak out, but the first thing we do is we change our passwords for any of those accounts that have been caught up in a data breach, okay? Because that's how we will always stay one step ahead of cyber criminals, okay? Is by changing the passwords. It's always, as well, why we always say we should have different passwords for different accounts, because if a cyber criminal gets a password and username for one of these accounts, then they may try and get into your other accounts using that same information. So if you keep them different or keep them separate, then you're staying one step ahead of them. So yeah, first thing to do, is go and change your passwords on those accounts. Well done. So talking of passwords, who here loves passwords? I'm imagining right now that you're looking at me a little strangely going, oh, I don't know what she's on about. But believe it or not, I love passwords. And this is simply because it is the only element of security that as a user of all these different systems that I can control. I cannot control how an organization sets up their websites and apps, and I cannot control what security they're actually applying to them, but I can ensure that I set up the strongest password that I possibly can. So what makes a strong password? Well, longer is stronger. So the more letters and characters you have in your password, the better it's going to be. Okay, because there are little programs called dictionary crackers, and they work on a mathematical algorithm to try and guess your password. So the longer it is, the harder it is for it to be cracked. It should contain uppercase, lowercase numbers, and special characters. It shouldn't be easily guessed. So things like your pet, your partners, your children's names are not great inclusions for our passwords because we often share this information on social media platforms. So it can be information that's easily found out about you. And we do also suggest avoiding sequential numbers and keyboard strokes. And most importantly, they should always be unique, like we just said, for different accounts. This prevents that domino effect. So if someone obtains or guesses a password for one account, then they could potentially use it to gain access to other accounts that do use that same password. So a little technique to creating strong passwords is what we call a passphrase. And so the recommendation, the latest recommendation is to take 3 to 4 words, random words that aren't associated with each other, and you mash them together. So I'm not really sure mashing is a true security term, but I love the words. We're going to mash them together. So here's a couple of examples. So we have mashed some words together, and then we've actually just sprinkled in a little complexity by popping in some capitalization and some numbers and some special characters. So the first one is Somewhere Over the Rainbow. The other one is Cats and Dogs Love Sunshine. You could even just use things like turtle cake shoelace, some random words, and pop them together. So this is really useful because one of our final tips is we want you to keep those passwords secure. And one of the things we always see is that people write them down, and they put them on post-it notes. And then, especially working in the hospital system for a very long time, I see them stuck to computer screens all the time. Then any security we had for that system no longer exists. We also used to see a lot of passwords put on the back of ID badges. That's also not a great place to store them. And also avoid saving them in blank notepads labeled passwords on your desktop, because these are things that will be targeted by hackers if they are in the system. Instead, by using the passphrase mash idea, you can write down a hint to the password without actually writing down the password. Another great idea is protecting in what we call a password vault, which we'll talk about later on. So while passwords help to protect against unauthorized access, they can be cracked by malware known as password crackers, which is called a brute force attack. This is why things like multi-factor authentication is so important, because it provides a necessary added layer of protection just in case your password is breached. So today, most accounts such as MyGov and the different banking apps require MFA by default. So if you're not already using it, consider setting it up on all accounts where it is offered. And you can use authenticator apps such as Microsoft Authenticator also to generate one-time passcodes for you. Another element is to protect ourselves is to look at our privacy and security controls of our social media accounts. So I think I could probably guess or count on one hand how many of us have actually read the terms and conditions of a social media platform or service before we actually accept or download that onto our device. Very few of us do, and let's face it, to use these services, we know we are handing over access to some of our personal and private information to do so. So protecting your privacy online is essentially a risk management process that we all undertake. So a couple of the key things you can do, though, to protect yourselves is to do things like look at disabling location sharing on the different platforms that you're using, as your location can be used in targeted attacks. You should check each site's terms of use to see what the data the social media companies are collecting. And if you don't like those terms, you may wish to consider not using that particular media platform. TikTok is a great example of that. Only accept friend requests or connections from people you know or through people you trust. This is a particularly good rule for sites like LinkedIn, okay? Because LinkedIn, we are trying to connect with as many people as possible, possible, but it's also a great way for us to connect with people that may be a bit nefarious. Limit who can see your bio and other contact information, again, as this will help you to control who has access to your information. And always think before you click on the post. Consider what you share and who can see it. For example, you may want to post your holiday photos, which is very exciting to do. I'm at the airport, I'm about to go on my holiday, I'm about to hop on the plane, but it will be evident to anyone who can actually see your profile that you are not home. And this can actually make you more susceptible to a physical attack such as home burglary. Always set your page or profile to private, as this will reduce the amount of information that's publicly available. And at this point, it's a great idea to regularly do a Google image or word search on your name and just see what appears. You might be quite surprised. Another highly recommended step to protect yourself from cyber attacks is to keep your devices and software up to date. This ensures you're running the latest versions, which is always a fix for any bugs or any known security vulnerabilities that may put you at risk. Okay, and a tip here, a tip right now is to set up automatic updates so this happens seamlessly. The next step is then to back up your important information. So a backup is simply a copy of all your important files, so your photos, videos, documents. So instead of storing it all in one place, like on your computer or your phone, you actually keep a copy of everything somewhere safe. And having copies of your important data that you can successfully restore is a protection measure. This ensures that if something happens to your device, such as fire, flood, theft, loss, or a malware attack, you won't lose your important data and your precious memories. And we've on the slide you can see now, we've got a link for the Australian Cybersecurity website. They are a fantastic resource and have some step-by-step guides if you'd like to learn more about this. A final element of device security I think we can often overlook when we're talking about cyber is the physical security of our devices. So that's making sure we lock our screens when we walk away and protect our devices when they're unattended. In another presentation we have delivered, we were discussing this topic, and a clinician actually shared a story with us where while they were working on one of the laptops on wheels, they're working by a child's bedside, they needed to step away and speak to the parent. So when they did step outside the room, they left that device unattended and unlocked. When they returned, they saw the child having a wonderful time playing games and reading the emails on the computer and browsing the web. So now, while this may seem like a relatively harmless example, we need to keep in the habit of locking our devices to ensure no one can gain access or tamper with sensitive information. So if you're using a Windows device, we have a little poem that can help you remember to lock your screens. And it is Alt-Control-Delete before you leave your seat, or Windows L works as well. That will get stuck in your head, I'm sure. So the Australian Cybersecurity Centre is available to help all Australians impacted by cyber incidents. If you are joining us today and you're working within a state or private facility, it's essential to follow their processes, which will most likely be to report any incident to your IT department. However, if you're working in a private practice or at home, you can contact the Australian Cybersecurity Centre on the number on the screen. They are 24-hour a day, 7-day a week service, and they are designed to help you in the event of emergency. They also have some fantastic resources, like we just said before, some step-by-step guides on how to be more secure. So we do recommend visiting them. And it's also important to know there are many resources available to you if you've been personally impacted. I have used ID Care following the Optus data breach, and most of these agencies have a social media presence. So we strongly encourage everyone to follow them on your social media platforms, as they will then keep you up to date on all the latest scams and information that's you need to know to protect yourselves. We also, within the agency, have developed a free e-learning course for people who work in healthcare. This is the Digital Health Security Awareness course. It has recently been updated and was actually developed in consultation with representatives from a large range of healthcare settings and disciplines. So this actually brings us to the end of the presentation. We really hope you enjoyed this session and have a few new skills or some different things to think about when protecting yourself and your organisations when online. Thank you so much.
Thank you so much, Tracy and Kim. That was fantastic. I have to say that I learnt a lot of information on you, but there was absolutely some really good handy tips in there. Thank you very much. Nikki, shall I hand over to you?
Pleasure.
Yes, thank you. I work at the agency myself, and I absolutely love that. That was fantastic, and I think it's really important for people to actually access that website to see how many attacks you've actually had. I was actually kind of surprised myself. All right, so Kim, one of the questions, Kim and Tracy, we've got here is, how safe are hospital digital systems and MyGov?
Yep. Look, they are safe. I think everything, especially hospital systems. I worked in Queensland Health for 28 years, believe it or not, a long time. And hospital systems are secure. What we need to remember that is all systems are secure as the people using them as well. So things like, think back to the credential hack for Medibank Private. We as staff need to be responsible for our actions as well. So we need to be really vigilant when we're using our computer systems and making sure that we're doing everything we can to protect the information, not by not clicking on links and phishing emails and things like that. With MyGov and the My Health record system, we have lots of extra layers of protection around those as well. Agency staff, we don't have access to the system itself. So, those kind of breaches can't really occur for us. So, but the systems themselves are safe and secure. Everyone does their best to put all the right protections around them, but we also have a responsibility to make sure that we're doing what we can to protect them.
Thanks, Tracy. One for you, Julie.
Yes, thanks. So Tracy and Kim, I've got a question here. What are some of the biggest cyber threats facing the healthcare industry at the moment?
So we know that healthcare is a honeypot of high value information and will constantly be targeted by criminals. So we did cover the key cyber threats, which include phishing emails, business email compromise, and ransomware. These remain the largest threats to any organisation in Australia, not just healthcare. And the recent Medibank Private, Optus, and now Latitude data breaches have demonstrated the fallout of cyber criminals accessing company data and the lasting impacts it can have on business continuity, reputation, and customer trust. So it's essential that you know how to respond if you have clicked on a malicious link, and training yourself and your peers and your family to recognize and how to respond to potential phishing emails and cyber threats. So as we mentioned as well, we do have that digital health e-learning course that's available for you and your teams to just gain the essential skills to fight cybercrime.
Yeah. I just found it so interesting that a health record is actually more money than a credit card. Isn't that amazing? I wouldn't have never thought that.
I love that stat because when we look at it, like we said, credit cards, we can replace them so easily. But the amount of information that's sitting within your healthcare record is phenomenal. And I think these latest breaches have really shown us the true example, and the fact that people can use that for extortion because these people have no morals, the ones that are stealing this information. And there is just so much can be done with that information, which is why it makes it so valuable.
And I guess there's a comment in there from one of the attendees. It saddens them to hear of all the vulnerable people who fall for these phishing attacks, like the hi mum. And it is, I've actually had it actually came through as hi mum and dad. And our children would never do that. So, I mean, it's all right for us, but it is something we actually stopped and thought about. So they really don't have any morals as such, do they? And they don't really care who they attack.
Vulnerable, isn't it? When your child says hi mum, you're like,
yeah.
Exactly.
And that particular scam, it saddens me because it is one of those ones that, as a parent, the first thing you want to do is, because there's one going around saying, I'm at Woolies and I've brought the wrong card. Can you please transfer money so I can pay a bill? And I know people personally, because I'm in a dancing group with a lot of elderly women, and they have actually responded to help their kids. I got it, but I only have a dog. So I knew that they hadn't sent me the message. But it is very sad. And it's so, these are things, every time you get that message, you have to critically analyze. And it's a sad thing we have to do, but we do have to always stop, think before we react. Okay, don't rely on that information.
Absolutely.
Yes, I was going to say it was the same, Kim, when you were identifying the websites. Like I don't contemplate, the websites. Although you do see when you put in a Google search, you see some that say sponsored, And I've been stuck with some of them before, like I've been looking for something and it's really cheap. I'm like, that seems unusual. And of course, it's a scam.
Yep.
So I have another question here, and you talked a little bit about passwords, which were some really good tips. But are password generator apps worth using?
So yes, in short, they are definitely worthwhile getting if you're willing to manage them appropriately, because there is no silver bullet when it comes to security, but password managers, which is like a software on your phone, or you can actually use them across multiple devices. But what they do is they stop the use of simple passwords and the reuse of the same password over and over again. And then they give us a place to store them that is more secure than, say, a notepad or a post-it note. But, you know, they're not infallible. You should do your research before picking a password manager. Pick one that suits your needs. You do still need to create one master password to protect them all. And you don't want to lose that password, because that's how you access all your other accounts. And it can be a bit timely to then work that out. But you also need to understand, for example, LastPass, that's one of the best in the market, but it has suffered its data breaches. So you need to keep aware that there are data breaches against these systems. And password managers, while they're great at protecting your passwords, won't protect you against other attacks such as phishing emails. And not all password managers require multi-factor authentication. So it's important to do your research with those. But one final tip is, so if you do use a password manager now, or even your current antivirus software, that's the type of phishing theme that we're seeing out there as well, is that you might get emails from scammers saying, hey, your antivirus software, your password manager is coming up for renewal. Make sure you update your details, or if you don't want it to auto renew. So always just think back to those indicators. Just always critically analyze any emails that come in before providing any information.
And I guess on that, we've got someone who wants to know, do you recommend a particular password manager?
Sorry, a bird just hit my window. Sorry. We don't really, what we do say is think about what you want out of your password manager, because there are a lot of free ones out of there and there are ones you can pay for. So obviously the ones you pay for will give you a lot more options. The free ones, I've used free ones before, they are good. You just look at what the different password managers offer and see if it meets your needs and requirements. And like Kim said, it's about having that really strong master password, because as we've seen, even the best ones have had their own little breaches at different times. So again, it's that risk management process we've got to look at every time. So.
Okay, so we've got another question here. So you've both referred to the breaches, the Medibank Private and the Optus one. What lessons could we all take from those breaches?
Okay, yeah. So I think the big thing is we need to understand that data breaches can lead to that reputation and financial damage. And it's really important for us to have really strong cybersecurity measures in place to protect our data, and now more than ever. So no matter whether you're working within a big organization, whether you're working in a small practice, or whether you are just looking at cybersecurity for your own self, understanding how to protect that information in your care, whether it's your information or someone else's, it's absolutely essential. Kim's covered a lot of those really simple steps today, and they are, just to reiterate, things like always backing up your information. That is critical, okay, because by regularly backing up your data, you can actually minimize that risk of data theft and ensure that critical information is always stored in a safe environment. And it can really help to also restore lost data really quickly if an incident has occurred, to minimize the impact on operations. So that's really important. Multi-factor authentication is another really important lesson I think we can take, is having the multi-factor to protect your digital assets. So, if a cyber criminal was to obtain your login credentials, then they wouldn't actually be able to gain access to your account until they could actually authenticate with that second option. So it's things like, your biometrics or your verification codes. That's your face, your fingerprint scan, or your PIN code that you might have to put in. Also think about restricting admin privileges if you're in a position to do so. So that means ensuring high level access to systems is only available to authorised staff, and that if staff are leaving different practices, that those admin privileges are taken away immediately. And the big one is training. Okay, we can't talk about this enough, is by educating yourself on how to be cyber safe. So recognizing those phishing emails, understanding the creation of strong passwords, and then also understanding that general threatscape is essential into protecting ourselves and stopping some of these major breaches from happening.
Yeah, perfect. So one of the questions here we've got is, what would you be looking for in a password manager? Is there something that we should look at specifically? I mean, obviously buying, you mentioned before, ones that you purchase obviously have a little bit more security. Is there something, a better way for us to look at how we find the best password manager?
One element there, Tracy.
Sorry.
Sorry, I'll go ahead first and then I'll pass to you.
Thanks. We both want to talk.
Well, the first one, which I mentioned, was multi-factor authentication. Make sure it has that extra layer of provides that option, that multi-factor authentication option. And personally, this is just from a personal perspective, it would be choosing a reputable software. So making sure perhaps you're going with a large known antivirus company, or checking other reviews online as well. That's a great way to move forward. And Tracy?
Yeah, that's pretty much. And also, again, maybe just doing that bit of research, like Kim's saying, and looking at, have they been caught up in any particular breaches, and what are they now doing to, to make their systems more secure? But exactly what Kim said. There is no silver bullet on this one. Sorry.
I'm sure there's lots of nurses and midwives listening today who are interested in this area. So you talked a little bit about the education tools. Maybe you just want to expand a little bit more about where could they go to find out more information?
Yep. So Nicola might want to take this one, because we do have our site on.
Yes, thank you so much. And you did mention our e-learning module, which is absolutely amazing. We've broken them down. We've got, there's 5 short modules that you're able to do. So they go from 20 to 30 minutes in duration. You can leave the course at any time you like. They cover quite a few of the topics that Tracy and Kim have covered here today, and you can access those on our e-learning website. So I'll actually paste that in the chat, or if we've got some questions here we're not going to get to today. So we'll try and respond to those, and I'll share that link with Julie so that she can share it out with you as well to do those courses. We also have a podcast. We'll have a new podcast coming up with the cybersecurity team, which is fantastic. I highly recommend that you listen to that. Sometimes it's great to be able to just listen as you're driving along. So that's something to consider. We also have webinars that we do from time to time, like this one. So recommend that you share this presentation or the link to this webinar with any of your contacts so that they can then listen to the content and then follow that information. So they're 3 of the things that I recommend that we do. The modules are absolutely fantastic. I've done them a couple of times actually myself, and I think that you learn something new each time. But that's so anything we haven't answered today, we'll send through to Julie, as well as those links.
Absolutely, thank you. Well, as we come to a close, thank you for all the interaction and discussion today. The chat has been very live, which has been very great. It's really, I've learnt so many practical tips. So thank you very much to our presenters, Tracy, Kim and Nikki. And thank you everyone for attending the webinar today. And as Nikki said, the webinar will be available, and we'll put it on the anmf.org.au website. So if you are interested in watching again, which I'm sure you are, that it's available for you, or you can send it on to your colleagues. And I hope you've really enjoyed the webinar as much as I have. And just a reminder that we'll send out the evaluation for the webinar via email, and we really appreciate any feedback to make these webinars better. And thank you very much. Have a great afternoon.
Thank you.
Thank you.